Welcome back to Med Scenarios. My name is Ghazi Ali Raza, and today we have with us a guest. This is Dr. Kamara. She is a second year emergency medicine resident from Makerere University, College of Health Sciences. Welcome, Dr. Kamara. How are you?
I'm fine. Thank you, Dr. Ali.
We are very pleased to have you here.
I'm very excited to be here.
Now, Dr. Kamara, I would like to inquire a few things about emergency medicine as a specialty. What exactly is emergency medicine in your view?
Emergency medicine is a branch of medicine that deals with treating any sudden illness or injury.
But talking of it from a practical point of view, like if
Mm,
I wanted to go into emergency medicine,
mm.
what would it be like for me?
Okay, so to explain what emergency physicians do, I'm going to first explain the three main categories of emergency medical services. So we have the pre hospital, and then we have the in hospital care, and then in between there, we have the transport. So, pre hospital care, that's at the scene, what we call the scene. That's where you get your sudden illness or your injury. And then in hospital care, that's in the emergency department at the hospital. And then transport, that's the ambulance system and the transport system. So, emergency physicians can work in any of those three areas. Okay,
Okay.
the three areas work together to make sure that if you get a sudden illness or injury, you can call someone and you are moved from the scene to the hospital in the shortest time possible. So there are emergency physicians who work in the ambulance systems, for instance, in the transport system. They work moving patients from the scene to the hospitals, and this can be so varied. That's where you have like aeromedicine. You might be moving someone via helicopter from the scene to the hospital. It might be you might be moving them across the water, marine medicine, and then there are emergency physicians that work in hospital care. So those ones work in the emergency department. They they receive patients and treat them within the hospital. Yes.
This
So
is this is really interesting because I thought that most of emergency special medicine specialists they are usually in the hospital working like normal specialists who let's say they have their own ward or working like that. But I see that it's going all the way to some airspace and marine underwater. What's going on here?
yes, emergency medicine is the specialty where the medical world interfaces with the rest of the world. It's all the way from at home where you fall sick, at the event where you are when you get an injury, on the way to the hospital and the hospital.
So I could say that it starts from where you are and you
Yes,
end up at the hospital. That's how emergency medicine is.
yes.
But
Mm,
I've heard that most of my friends have told me that when it comes to emergency medicine, they usually see certain types of patients. They don't deal with all kinds of patients. I don't know if that's a myth or something, or is it the the point in which they come in, like the progression of the disease. I don't know. What is it actually? Could you give me a bit of an idea and clarification on that?
So it cuts across pediatrics, obs-gyn, adult medicine, trauma. So one of our emergency physicians told us when we were beginning this program that as an emergency physician, you're supposed to be able to see any patient of any age at any time that has had a sudden illness.
That has had a sudden illness.
Yes.
That's interesting
Mm,
because now, let's say if someone decides to go into cardiology after finishing internal med, I think they're seeing only particular set of patients. It's like that's their niche when it comes to seeing patients. But now, as you have said, emergency medicine, you can look at everyone from pediatrics to adult care to anything.
mm.
But it just came to my mind right now as I'm speaking to you that there's a specialty called family medicine,
Yes.
and they also I think they see everyone in the family.
Yes.
Age is not a limiting factor,
Mm.
but I don't know what's the difference between that and this. If you could
I think
probably
the difference between family medicine and emergency medicine is that With emergency medicine, you're dealing with an illness that has come on suddenly, one, and two, it's life-threatening.
Ah,
So in family medicine, you may see a lot of illnesses that are not life-threatening in that moment, but emergency medicine is all about handling that life-threatening condition as fast as possible to save that person's life.
I get that now
Yes.
because I think family medicine doctors are usually in the clinic sitting there,
Mm.
seeing patients on a longer term. I think
Yes.
they follow them throughout their life.
Yes.
But I think an emergency medicine specialist deals with the emergencies, as you could put it, the
Yes.
acute conditions then and there.
Yes.
Um, I have been to the hospital and I've seen that I think casualty is where emergency medicine department is usually. And I
Yes.
see there's a lot of chaos.
Yes.
Unlike other wards where there's always a procedure, there's always a proper ward round. We get done with the ward round, and there's always time for doing the lab test, and then you report back tomorrow. I think emergency medicine, everyone is doing their own thing here and
Mm.
there.
Yes.
So I don't know, how do you deal with all that as a resident?
So I'm going to quote an emergency physician
Okay,
again that said this to us. She said, embrace the chaos.
embrace the chaos.
So what we do in emergency medicine, it's organized chaos, by the way.
Okay,
I'm not going to say it's not total chaos. It is organized. We have a system.
okay,
We have triage. Triage is like our system in the emergency department. When people get ill suddenly or when they get injury suddenly, there's a lot of panic. There's a
uh,
lot of fear, anxiety. People come, sometimes they've been helped by people they don't know. Anyone can bring you to the hospital. A stranger, your child, who doesn't know anything, but has brought you to the hospital, wants to help you. So it is chaotic, but we embrace the chaos and we make sure that we save your life in the chaos.
that is interesting because there's a lot of chaos. I agree, there's triage and everything. But I feel like with that anxiety and trauma, does it take a toll on you as a doctor? That's my major concern. I feel like there's a lot of burnout, or I don't know.
Mm,
That's my understanding from being in casualty for a few weeks as a medical student.
mm.
But I don't know, how have you been managing lifestyle? How do you balance life and being a doctor as an emergency medicine resident? And how do you not take back that luggage with you at home at the end of the day?
It's challenging, honestly. The life of an emergency medicine resident is a juggling act. You have to juggle your reading. There's a lot of reading to do around this specialty. And then you have research, and then you have your other life. You have your family, you may have hobbies, you may have other ventures you're
Yeah.
into. So you have to go in with a plan
Okay.
to balance everything out. Um, I could say it helps to
Okay.
keep yourself healthy physically and mentally. You have your shifts. Of course, shifts are planned out. They're given to you in advance.
Yes, that's true.
Yes, but it takes some discipline to know that when I'm not on my shift, I need to do this. I need to rest. I need to eat a healthy diet. I need to rest my mind sometimes.
I get the idea. I think mental health is
Mhm.
also something important for doctors, especially in emergency medicine with that organized chaos that you've been talking about. Now, how does an emergency medicine resident's average day look like? What's your routine like? Take me through that 24 hours cycle.
So this will depend on which clinical rotation
Clinical.
you're in.
Okay. Okay.
So by the way, when you're doing emergency medicine, you you rotate in the adult emergency department, in the pediatric emergency department, radiology, ICU, obstetrics and gynecology. So depending on where you are, but wherever you are, you're going to be placed in the area where the emergencies come in. So this is what a day looks like. Your day starts early because normally you're on a shift. So if the shift starts at 8, when you get there at 8, you need to make sure that you've had a good meal.
That's true.
Yes, and you're not feeling, you're not ill or anything.
Obviously, you don't want to become the
Yes.
emergency on what.
Yes, you don't want to become the emergency. So you need to have had enough sleep, had a meal, and use the bathroom.
Obviously, yes.
Because once you're on shift,
There's no moving out of it.
there's no moving out of it. Once you're doing CPR,
That's the worst. I was, as a medical student, we had a situation where I was where we had a patient who was not responding well, and we all, as students, there was SHOs, there was specialists, and all, so we all had to do CPR.
Mm,
So we had to do turn by turn.
mm,
Even while doing turn by turn, we were there for around 30 to 40 minutes
mm,
continuously, and it was a nightmare. You could not take any break. You cannot complain that your back is hurting. You can't complain that you're tired.
mm,
So I
yes,
guess what you're saying.
yes.
So after
So
having prepared everything,
so when you get to the emergency unit, you make sure that you have all your equipment ready. Your resuscitation equipment should be all ready and set to go in a minute, the
yes,
moment a patient comes in. So you make sure your crash cart is stocked and arranged. The crash cart has all the emergency drugs, it has the emergency airway equipment. So once your resuscitation equipment and your crash cart are all stocked and ready to go, then you do a general survey of the unit.
okay.
Yes, before you go in detail patient by patient, you must have an overview
So
of,
basically, it's
of
like a
what's going on.
triage to say that these patients are at most risk. They
Hmm.
need to be monitored more,
Yes,
and these guys, we can take them, we can give them some time and come back to them.
exactly.
Okay,
It's you need that quick overview
quick
to
overview.
see where do I start and who should I prioritize. So when you've done that, then you're supposed to go. You start with what you think needs to be done urgently. Remember, the emergency medicine is about saving lives. So it's not about who came first. It's about,
Priority is to save life.
yes, it's
That's true.
about who needs you first. What needs to be done first. So you start with the most critical
Critical.
thing to be done, and you work your way down. Yes. Then, of course, as you're doing that, this is an emergency unit. Another emergency can come in at any time. So that's why you need to have your team ready. Yes. Another thing you need to have at the beginning of your day is a team already assigned. So you already know who your nurse is. You already know who's
So
your,
everyone with their roles, they're
yes.
they're prepared from beforehand.
Yes, ideally you should have your code team ready,
Core team ready.
so that if in the middle of your day an emergency comes in, you just call everybody, come, we have a code here, let's do this. So that's how your day goes. Your day goes basically attending to new emergencies and moving patients from the emergency unit to where they need to go. And also there's a lot of interaction with other
Specialty.
specialties. That's one of the unique things about emergency medicine. You have to work with every other specialty. The emergency physician is the one that calls the neurosurgeon, orthopedic surgeon, or oromaxillofacial surgeon to come and look at the patient
Patient.
if they need that.
So consultations are always called in, and we see
Yes.
how that goes up.
Yes.
This is interesting. And then,
Mhm.
what time does the day end?
Yes.
Mostly, that would be a major question to most people choosing a specialty,
Mm,
is the duration of time that you spend in the hospital. Because let's say surgeons, they're usually even having surgeries at night.
mm,
So they're there for longer hours. That's like a known fact in the medical field.
mm.
But when it comes to emergency medicine, when do we go home?
With emergency medicine, your day ends when your shift ends.
Okay,
Yes. But in our situation here in Uganda,
okay.
because we have a lot of socioeconomic challenges, patients don't move out of the emergency department as quickly as they should. We have challenges with getting investigations done, radiology, imaging. So your day ends when your shift ends, but oftentimes there may be something to hold you back. And then you'll stay. For instance, a patient that came in maybe 30 minutes to the end of your shift and maybe needed intubation, you will stay around until the patient is safely intubated and stable on a ventilator. Yes,
Uh,
so it's a little bit it's
Unpredictable.
a little bit unpredictable,
But mostly
but
it's
mostly,
shift wise.
yes, mostly it's shift wise. I actually love that about emergency medicine. I like the shift arrangement. You
Different.
always know when you're supposed to come in and when you're supposed to leave, and
So basically, you
you
hand
know,
over the patients as you're leaving, and then you don't
yes,
have to take care of them later.
yes, as long as you've handed them over properly,
Uh-huh.
they're in good hands. They'll be safe. If anything happens, they can always we consult each other.
But not like a surgeon where they're called at
No,
night to get up and come back to the hospital.
no, no,
Uh,
no, not like that.
I remember there was a time I was in casualty at night.
Mm,
We were in our surgery rotation, I think, and we had to be there to get some experience and clinical exposure. So we were there till morning at 4. We started around in the evening at around 6. We had reached morning at 4 o'clock, and we wanted to leave, and we wanted to get our signatures to fill our logbook and leave as students. We were always running away from the ward. So as we were about to leave, there was an emergency that came.
yes.
So dealing with that patient, it ended up pulling us up till 8 in the morning. So instead of going back home and taking a nap for an hour, we went straight to vote from there because we had no other option.
That was must have been awful
Eh,
up to morning, but it does happen. It's happened to me as well.
Okay.
Yes. That was long. What was that? What emergency was that?
The patient had an accident
Mm,
and they were unconscious and not responsive. Their
mm,
pulse was steady, and we wanted to make sure that at least we get the right pulse back. They were breathing, but very slowly. The challenge was that we were not able to get a cannula in because all the veins had, I don't know what's the right term for it, but we are not able to put up a cannula. We
mm,
tried every single vein possible. It wasn't working.
mm,
And this was at the time, I think, when emergency medicine was still in its early phases in Mulago.
mm,
And yeah, so we really tried up. And in the morning, when the other senior doctors came in, the residents were with us at night, but the senior doctors, in the sense the specialists, when they arrived, they, I don't know, they are miraculous people. They just found that vein just in an instant. We're struggling for like 2 hours to get to put in fluids to resuscitate the patient. But yeah,
mm. Yes, sometimes it can go like that in the emergency unit. You can get something that's really like you don't have a way out, and then you have to call in backup a lot of the
back up.
times. Call in maybe an anesthesiologist or call in the
That's true.
orthopedics
That's true.
surgeon, something. Yeah.
No, but I have seen that all this can take a mental toll on the doctor. But I saw that it's more hard for the patients. Like you said, they come in with anxiety and all. So, is there an element of psychiatry that comes into emergency medicine? Because psychiatry is such an isolated field on its own.
Mm.
But is there a portion of it that can be associated with emergency medicine, especially in a casualty unit, like an emergency unit?
Yes. You mean emergency psychiatric care, or
I
is
don't
that
know.
what you
Is
mean?
it emergency psychiatric care or is it the way we present ourselves to the patient
Mm,
when they come in with an emergency? Let's say someone had an accident, the
mm,
family members come in
mm.
and they're all panicking.
Yes.
Now, how do you handle a situation like that? Or there are
Oh,
some
yes.
patients who are very reluctant to take treatment,
Mm.
or that the so-called difficult patients. So
Yes.
does psychiatry also take part into that in the way you provide care for the patients?
Uh, yes, it does. First of all, controlling the emergency room is something we have to learn, because, like you said, it's a chaotic place. So you have to get things under control in order for you to focus and do the right thing. If something proves to become a distraction, you are you are allowed to ask them to leave the emergency room
Huh,
so that you can give the patient the best
the
care.
best care possible.
Yes, and we also learn how to deal with patients that are very anxious, or that even come with we deal with psychiatric emergencies as well.
Okay.
Remember, so even if someone comes in very violent and loud and destroying things, we know how to de-escalate the
The situation.
situation. Yeah, So you start by verbally de-escalating the situation, and then you can use drugs. We have drugs we use to
Calm
calm
them.
people down. Yes, but that's a very important point. Control of the emergency room is very important.
I can
Yes,
understand already there's a lot of chaos. You don't want it
yes,
to escalate. You
yes,
want it to be, like you said, controlled in some
yes.
way or the other.
Mm,
And after finishing all this, when you leave the ward,
mm.
is it like a sense of relief, like I'm done with today and no one died on the ward at my hands?
Well, I love it so much that I wouldn't call it a sense of relief for
Okay.
me. I feel relieved when an emergency came in and we managed to get the person into a much better place, and move them on to what they needed.
So is it more like
So
I would say it's more like satisfaction to
yes, I get
save
a
a
lot of
life.
yes, I get a lot of satisfaction
Okay.
from that, but it is exhausting.
I can
Yeah.
imagine because
Mm,
I had one of my friends who was telling me that on ward, let's say someone goes to a GI ward, they're being treated there for a week or two, and then they recover and they come out. It's a long process for them to actually recover.
mm.
But in emergency medicine, you see the changes happening very quickly in front of your eyes.
Yes, it's awesome. In emergency medicine, if you act on time, you see changes in real time. Emergency medicine is a very time sensitive specialty, by the way. So we actually have time targets. It's about hitting time targets.
But what happens when it comes to going back and reading and particularly research? Because I feel like everyone is trying to now find the best possible way when it comes to, let's say, resuscitating a patient. They're trying to find the most ideal way. They have that data and all.
Mm.
Do you have to also deal with research as a resident, and what's it like?
You have to deal with research as a resident. So our residency programs in Uganda require you to do research. It's mandatory. So I we have a lot of help when it comes to that, luckily.
That's great.
So yes, so our supervisors, we are given supervisors at the beginning of the program, and they help you look through the different problems in the specialty, the different questions in that specialty, and then you will come up with something. There's a lot of support with research. I don't think it's something very worrying that should worry you very much. You'll get a lot of support
Because I
to
was
do your
thinking as a
research.
student,
Mm,
going into that organized, chaotic environment, and
mm,
then trying to collect data at that
mm,
in that unit where everyone is moving around. It might be a bit tricky when it comes to other specialties,
mm,
but I think, as you're saying, if it's doable, it's good.
mm.
Uh, but how does it differ from other countries? Because I think Uganda is a place where you have been describing us.
Mm.
I don't know if you have friends in other countries who are doing emergency medicine and what's their experience been like.
I okay, I've only done emergency medicine in Uganda, so I'm not so sure about other countries. But some of the visiting students we've had, when I've talked to them, it seems to be pretty much the same. It's it's chaos. It's
Okay, hands
very
on.
it's very hands on.
Mm.
It's very you have to. It's very fast paced in general. The differences that I've seen are our infrastructure differences. For example, we don't have ambulance systems everywhere yet. We don't have them set up yet. We only have an ambulance system that works in Kampala city. Outside Kampala, unfortunately, we don't yet have ambulances. And then also we have in the in-hospital care, we have a few differences. Here, it's not so easy to get imaging very quickly. We don't have on-site blood banks everywhere, so blood
So
transfusion
it's mostly
services.
the infrastructure and logistics that have been a
Yes,
challenge.
yes, I think that's where I see the difference.
But when it comes to doing the actual procedures like intubating patients, I think as emergency medicine residents, you have to intubate patients, certain
Mm-hmm.
patients who need
Yes.
to, uh, where you can make sure the airway is
Mm-hmm.
secured. So how is that different from other countries like, let's say, US or UK? Do they also have hands-on training where they're doing most of the things? Do they take part in minor surgeries to stabilize the patient or not? And how does that compare to Uganda?
From the emergency physicians I've interacted with, it's quite similar. For example, they have to do a lot of intubations in the ED, same as all the other ED procedures. Inserting chest drains, uh, splinting, immobilizing fractures. It's quite similar there.
That's great. Great to know that we are at their standard also,
Mm.
because we have started recently and they have started earlier.
Yes,
I think they started long before than us. Could you
yes.
give me a brief on that history part of this emergency medicine?
Oh, yes. So emergency medicine started in the United States of America. Um, the first emergency physicians, I think, trained in the late 1950s, and then emergency medicine was officially recognized as a specialty in 1979.
Ah,
And then, of course, after that, now it's spread to so many other countries. But here in Uganda, we started training of emergency medicine physicians. Started just about 6 years ago. Although emergency medical services have been around recently, in 2000 and 2018, our government, the Ugandan government, through the Ministry of Health, did an assessment of the emergency medical services in the country. So this was, of course, to look at the state of our emergency medical services and to find out our key priority areas. So the assessment was done, and then they found several key priority areas. One of them, of which was building human resource, which is where we come in.
capacity
Yeah, that's when they started the emergency medicine residency
program.
programs in Makerere University and Mara University. So that was one of the priority areas they found, which they are working on. So when that assessment was done, they came up with some kind of a policy framework that they launched in 2021. And that policy framework is what's guiding emergency medicine in Uganda
In
now.
Uganda.
Yes,
That's great.
yes,
It's great to see that much change in the past decade, I would say.
yes.
And how does this change moving forward? What's the prediction like in emergency medicine? How would life look like for you as a specialist after having graduated from Makerere, and what opportunities do you think are out there for students to pursue once they come into the field?
I think the opportunities are great. There's still plenty. Um, this is still a relatively new specialty in the country. We have just a few, maybe 20 emergency medicine physicians who have trained in this country, but not all of them are even in the country. So I think the opportunities are still very many. As far as our government goes, they've put positions for emergency medicine physicians at regional levels now, at the national level. There's a position for that. So that's a huge step, I would say, and that speaks of further opportunities in the future. And then there are also opportunities in academics, in research. There's still a lot of research to be done. This is a new area here.
In
Not
Uganda?
much has been researched yet. And then there are opportunities outside of Uganda. I know some people that have found opportunities outside of Uganda. So I would say there's still a lot of opportunity.
That's fabulous that for all of us who can look up to emergency medicine as a specialty in the future. If you are in charge of admissions into emergency medicine as a department, what qualities would you like in your students when they come to join in the first place?
um, for a student who is looking to join emergency medicine, um, I think the qualities that you need to embrace are open-mindedness. You have to be open-minded because as an emergency physician, you get undifferentiated patients. You get someone that you don't know what's wrong with them. You're not supposed to close your mind to only one thing. So you should be open-minded. You should be proactive. Um, Positive, I would say, because you always want to try your best for the patient and push to the maximum, like believe until there is no further option for the patient. So you need a bit of that
Perseverance and resilience.
yes, you need that perseverance, resilience, and the heart of an activist. You
Obviously.
need the heart of an activist, because you're going to have to fight, literally fight for your patient's life. And then you need good interpersonal skills, because you interact with every
And
specialty. Right there in your unit, you're going to have to interact with every specialty, make decisions with them, go back and forth on decisions, agree, disagree.
so there should not be communication flaws
Uh,
that can risk a
you
patient's
Yes,
life.
you need excellent communication skills. You're going to communicate with the patient's relatives as well, with the people that bring in the patients. And then you need the ability to be calm in chaos.
Okay. Thank you, Dr. Kamara, for coming to our show. Before we end, if there's any message you'd like to give to our viewers from your side, we'd be happy to have it.
Thank you for having me, Dr. Ali. um, the message I would give to, if you're a student watching this, emergency medicine, it's a wonderful specialty. I love the specialty. I'm excited. I'm enjoying my program, my training, and it's really difficult to describe it to you. Maybe come to the emergency department. We have a students interest group, so come join the interest group and see what we do. It's very hands-on. We show what we do. You'll get the feel of what we do, so that you can see whether this is the path you want to take, or or you're doing something slightly different.
Thank you, Dr. Kamara.
Mm.
It was good to have you on our show, and we're very grateful for all the information that you have provided us.
Thank you
Have a
so
good day.
much. Thank you for having me. It's been great. Yes.
Thank you.
Mm.
If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook, and TikTok.